Coming to you from Beaumont, this is your house call.
I had a patient who had walked in this week that was saying, I'm having some trouble hearing. And I was like, okay, like what's going on? Oh, it's just the right side. Okay. So I ended up looking in his ear and there was like this black, kind of crawly looking thing in there. And I was like, okay, let's see what we can do. I ended up, pulling it out and it was a cockroach.
Nice.
And I was like, wow. And he was like, oh my God. And he goes, well, actually, I didn't want to tell you that I felt like something was crawling in there. Instead, I just thought, my hearing's kind of gone and here it is.
Right.
And I said, okay, well, can you hear now? And he said, yeah, I can hear fine.
That's a good story. I see this kind of stuff a lot. Not cockroaches in ears per se, but it's pretty common to get the oh, by the way, right? Mm-hmm. The famous oh, by the way.
As you're walking out the door.
Right.
Yeah.
The patient's here for, a physical exam, but oh, by the way, I've also got this thing. And I find a lot of people are embarrassed to bring some stuff up at the office that, frankly, they probably shouldn't be embarrassed about. So that's what we're going to talk about today on the podcast. Embarrassing symptoms or questions that people don't often like to go to their doctors for. Hello and welcome to the Beaumont HouseCall podcast. I'm Dr. Nick Gilpin.
And I'm Dr. Asha Shajahan. Our goal is to help you and your family live smarter and healthier lives.
That's right. And so today it's all about embarrassing symptoms. So we gathered some common search items on embarrassing symptoms that people bring to their healthcare providers or doctors.
Or that they're searching on the internet to try to figure it out so that they don't have to go to their doctors.
And we're going to rip through a few of these one by one. So what do you got for us, Asha?
Okay, so one of the things that I commonly see and happen to be on the internet search as well was excessive sweating. Mm-hmm. People are very conscious about body odor, and I get a lot of patients coming in with concerns about odor of their feet or just like excessive sweating. And so the first thing I usually think about is like, okay, is this something, sweating is a normal part of life. It's a way of your body cooling off. And people excessively sweat when they're anxious or if there's a hormonal imbalance. Like there's a lot of reasons why people sweat. And there's a lot of different things that you can do about it. But I think when it becomes a concern is when there's excessive sweating, when maybe it's not hot outside or there really isn't a trigger for the sweating. And so that is called hyperhidrosis. And about 3% of our population has that. That's about 8 million Americans suffer from this. So it's not super common to have that, but I think a lot of people are concerned that they may have this disorder. So there's a couple things I think that if you are sweating excessively that you might want to see your physician for to rule out, prior.
Like what?
Like diabetes, hyperglycemia, hypoglycemia, having an infection. Hormone imbalance is a big one, especially for women if they're postmenopausal. And then anxiety is a big one. A lot of people, when they get anxious, it's their normal response that they start having the sweaty palms, etc. Thyroid issues is another reason to cause excessive sweating. Mm-hmm. So those are all things that can cause excessive sweating that you can correct, if you correct the hormone imbalance.
You keyed in on something I think that's important, and that is that there are sort of organic causes of excessive sweating, and then there are, I guess we'll call them more inorganic causes, right? Mm-hmm. By and large, what I'm reading about is that most excessive sweating is not due to some underlying pathology.
Correct.
That this is probably more of an emotional response.
Yep.
So that, I think, will put a lot of people's mind at ease because people might be thinking, oh my gosh, do I have cancer? Oh my gosh, do I have an infection? Is there something that is causing me to sweat like this? Ordinarily, it's just an exaggerated emotional response or an anxiety response.
Yeah, and I think a lot of times that people do is they'll, for example, let's say excessive sweating underneath the armpits, they'll get deodorant and they'll say they've tried like 4 or 5 different kinds.
Right.
And it's like some people just produce more sweat than others. So it's like you can try an antiperspirant or you can see your doctor for a prescription strength to see if that helps. And you can actually put deodorant on your feet. Did you know that? You can put deodorant on your feet. So a lot of people have sweaty feet and they don't know what to do about it. But it's like you can put deodorant on your feet or antiperspirant on your feet and it can help a lot.
So you go through the algorithm, I guess, of using an antiperspirant, starting with something that's probably over the counter because that's what you're going to have easiest access to, and then transitioning, if that doesn't work, to a prescription strength antiperspirant. And then what? What if that doesn't work? Where do you go from there?
Yeah, and I think at that point, if that's not working, then you start looking into some of the organic causes, like what are some of the things that could cause it. But there are other things that you can do, like Botox injections are pretty popular, especially for people that get the sweaty palms. You know, it can interfere with your life if you're going to a meeting and your hands are sweaty when you're meeting someone for the first time. So Botox injections are really good. There's actually anticholinergic drugs that you can take, which can kind of help block the body's sweat triggers.
Sure.
So those are some things that you can do as well. I think also just the simple things like spraying your shoes after you go for a run, before you go on a run, like those kind of simple things. But at that point, if it's still not helping you, then it's better to probably see a specialist regarding that, like a dermatologist.
I would agree. And I also want to just throw in that there's one other kind of sweating that might be worth talking about, and that's night sweats. So I think I want to differentiate sort of the hyperhidrosis camp from the night sweats. Because night sweats, you know, if you're waking up in the middle of the night, your clothes are drenched, and this is happening night after night after night, that could really be a sign of something that needs to be investigated. This is something that I actually get referred to quite a bit in my infectious disease practice because one of the major causes of night sweats is infections. So I think that that's something that should generally not be ignored. If you are having excessive night sweats, you should talk to your doctor about
where
that.
your sheets are drenched or your pillows drenched and that kind of thing.
Exactly.
Okay, very good. All right, so let's see what else came up on our internet search. It's constipation and gas, flatulence. I see this quite a bit. I don't know if you see that at all in your practice or
not something I see a ton of. Maybe a once in a while, but certainly something that people will ask about. I think that this is one of those questions that you might get from brave friends or family members who might just corner you and say, "Hey, by the way, been having this issue. I get, bloating all the time after I eat a meal or something like that. What's going on?"
Yeah, and I think a lot of people think, oh, I'm lactose intolerant.
Right.
Or they start doing the elimination diet, or is it celiac disease or that kind of thing. But sometimes it's just plain old regular constipation from not having enough fiber.
Let's talk about gas. So I think you keyed in on something right away, and that is that people tend to jump right to conclusions. I think that that's something I commonly see is we like our causes to be proximate, and we like to say, well, I ate X and I got gas, therefore it must be X that caused this. Not necessarily the case. In fact, there's two ways that air is going to get into your intestines, right? You're either going to swallow it, so you're eating or you're chewing gum or you're drinking liquids and you're swallowing air. That's, by the way, the most common way that air gets into your intestines. Or your intestinal flora may be producing gas as a byproduct of metabolism. So it could be something that you eat, or it could actually be the way that you eat.
Yeah, I think the way that you eat is big. Even like when you think about babies and babies having excessive gas and burping and that sort of thing, a lot of times it's because they're swallowing air, or if you eat really fast and that kind of thing.
And once that air gets in, it's got to get out, right? So you're either going to belch or you're going to fart.
Yeah.
That's just, there's not really many other ways that air is going to get out of your body. So.
Right, exactly. But even, what about like irritable bowel, like where people have constipation and diarrhea? And the one thing I've noticed about irritable bowel is that it's very common. A lot of people have it, where sometimes they have diarrhea and then sometimes they have constipation. And so they'll say, well, doc, I've been taking a lot of fiber, but now I've got diarrhea. Or whenever I get really nervous, I get diarrhea. And I think the thing that's important to know is that like everything's connected. So like your nervous system does play a role on your gut and especially your large intestine. And so if you happen to be nervous or have anxiety, then it causes spasms in your large intestine, which then in turn turns into problems with diarrhea oftentimes. And so a lot of times I tell patients that when it might not be exactly what you're eating. It might actually be your lifestyle, like how much stress you have.
Sure.
How do you relieve your stress, and ways to reduce your stress. And you'd be surprised how that affects your gut.
I think lifestyle modifications are an extremely important first step in the dance, right? Irritable bowel syndrome is a complicated disease because it's generally thought of as a disease of exclusion, right? You have excluded other organic causes of diarrhea or constipation. So by the time you have landed on a diagnosis of irritable bowel syndrome, you've probably been to 2 or 3 doctors already and had a multitude of tests performed.
Right, or colonoscopy. Yeah.
Right. So you've gone through the whole dance to arrive at this destination, right?
Right.
But the lifestyle modification stuff is something that you can do yourself. So I was just recently reading about this concept of FODMAPs, specifically talking about irritable bowel syndrome and people that are prone to excessive bloating and flatulence. And I'd never heard of this before.
I've actually never heard of it either.
And so what FODMAP stands for, this series of very long words, fermentable oligo-di-monosaccharides and polyols.
Okay, can you say that again like 5 times fast?
Basically what these are short-chain carbohydrates that your body does not do a very good job of digesting. And these are found in lots and lots of foods that you wouldn't ordinarily think of. So it's not as intuitive as, say, gluten, right? When you say gluten, people know gluten's a binder. They know where it's found. It's found in grains, et cetera, et cetera.
Right.
FODMAPs are found in all different kinds of fruits and vegetables and other things. So, for example, apples, right? An apple a day keeps the doctor away.
Right.
Apples happen to be one of those foods that are high in FODMAPs.
Oh, no.
So if you have a situation where you're not able to really break these FODMAPs down, eating apples or some of those types of foods may trigger excessive gas and bloating for you.
So do you think it's good for a patient to have a food diary and maybe look at the FODMAP and see what is it that they're consuming in that map? Or?
I think so. So like with anything else, I mean, if you can eat all these foods and they don't give you any problems, then you don't have anything to worry about. But if you find yourself getting excessive bloating or constipation or diarrhea, yeah, I think you do have to be more mindful of these. So you, as a primary care doctor, I'm sure that that's one of the things you would task a patient with. You'd say, okay, let's start taking a food diary.
Exactly.
And see where this goes.
Yeah, before jumping to getting a colonoscopy per se, that's one of the things I like to do is keep a food diary of when you have diarrhea, when you have constipation, what you ate that day. And just sort of kind of go through that and see what causes it. And I think the same thing with constipation. A lot of people will go straight for laxatives, and there's a lot of natural laxatives that you can take, you know, like having just chia seeds or berries, flax seeds, those kinds of things, leafy greens. So it's like try to modify your diet, like the easy stuff, modify your diet first and see if there can be a change before jumping to the bigger things that people tend to get scared of.
Want to move on to the next one?
Yes. Oh, okay. This is a good one. So,
what do you got?
Bad breath.
Okay.
Okay, bad breath.
Are you trying to tell me something right now?
You didn't have enough gum today, but now you're going to get gas from chewing the gum, and it's going to cause problems. But when I say bad breath, it's not like the bad breath of like, you know, you take mints and mouthwashes and all of these products and you still have bad breath, right? So people are like, what is going on, doc? Like I've got bad breath. And they say, oh, my dentist says I don't have gingivitis, so I don't know what's causing the bad breath. In infectious disease, I'm sure you see a lot of that too.
I do. As a matter of fact, I have had a few patients over the years that have come to me with this as their primary complaint. They've been told maybe that they might have a tongue infection like thrush or something like that, and they think that that might be the cause. I think important to distinguish right off the bat is, does the person actually have bad breath? Because there's a significant amount of people out there that think that they might have bad breath, but they don't really clinically have bad breath, right? So that is sort of its own pseudo condition that I think needs to be distinguished from real bad breath.
Right.
Once you get to real bad breath, then I think the majority of cases of quote-unquote real bad breath or real halitosis are caused by disorders of the mouth, the teeth, and the gums. Gingivitis, teeth that have not been cleaned or flossed, or trapped food, or the back of the tongue is an area that also can trap food, and that's where most of the bad breath comes from.
And then what's interesting is a lot of people that have chronic sinuses can also have bad breath as well. So a lot of times people go to their dentist and they don't think about possibly having to see an ENT for like what could be going on in the sinus cavities. The other thing are just things like tobacco smoking, that can cause chronic bad breath. And then dry mouth is a big one. So, when people wake up, they have that morning breath. It's because, they might sleep with their mouth open, or like overnight, their mouth is very dry.
Right.
And so if you're on medications that cause dry mouth, then you can have bad breath, or just improving the amount of water that you drink can actually help out with that as well.
Yeah, excellent points. I think that the initial evaluation of someone who has truly bad breath is a trip to the dentist. Okay, I think that's generally the first step. And then if you've tried the lifestyle modifications, the brushing, the flossing, the good oral care, and you're still having problems with bad breath, then I think the next step would be a visit to an ear, nose, and throat doctor.
Yeah, and then, or even sometimes a gastroenterologist, because if you've got really bad GERD, like acid reflux, that can also cause bad breath. And sometimes people aren't symptomatic per se with pain or burning, but they have the bad breath from the acid reflux. So if they start controlling their diet in terms of like lowering their caffeine and spicy foods, then they can improve that as well.
Excellent. Any more topics?
Let's talk about this one, is hair loss. I see in my clinic a lot of people have trouble talking about hair loss, especially women.
It's a pretty charged topic, right? I mean, we put a lot of value in appearance, and hair certainly plays a vital role in that for a lot of people. So
yeah, and the thing is, there is a natural part of aging where you will lose hair. Like when your hormones change, you'll lose hair. I mean, when I shower and I like pull out, I got tons of hair that comes out too. But there's a difference between alopecia, which is, like a actual balding of the scalp where you have patches of no hair growth whatsoever, and then just like your hair falling out. Like stress can cause your hair to fall out. Your thyroid hormone can cause hair to fall out. Being in menopause, like all of those things can cause hair loss. And a lot of women start freaking out because they're like, oh my God, I don't want to go bald.
Very good point.
But there's a couple of things that I think that you can do for that, what I call benign hair loss, where you're just losing more hair and you're not necessarily balding per se. And that, again, goes back to your diet. It's like eating more proteins. Like egg whites are great. There's even like some remedies of actually putting egg whites in your hair.
Interesting.
And in your scalp, because it's rich in really good proteins that are good for your hair.
Is it biotin? Is that the one that's supposed to be good? Yeah.
Absolutely. Biotin's really good. So vitamins like vitamin D is really important for hair growth. And then B12. So if you're a vegan or you're not getting enough B12 in your diet, that can also cause hair loss. So if you're having like excessive hair loss that you're noticing, you might want to, check your diet, see what you're eating, but then also you can get your vitamin levels checked and your hormone levels. And then one thing that a lot of women have that they don't realize is related to hair loss is low iron. So if you have a heavy menstrual cycle and your iron levels are low, just taking iron supplements might actually help with your hair growth. So many people think about, thyroid, but they often forget about checking the iron levels as well.
I read that it's normal to lose between 50 and 150 hairs per day.
Yeah, I hope so, because I think I lose about 150
which sounds,
per day.
which sounds like a really high amount, right? So if you think of, if you lost 150 hairs instantly, you would notice it, right? But over the course of a day, you're probably not going to notice losing 150.
Yeah, and over time it does
hairs.
grow back. That's the thing. And I think scalp health is really important. So like if you're not taking care of your scalp, like exfoliators for the scalp, we do that for our skin. But really taking care of your scalp with making sure you have good shampoos and conditioners, that can also help as well. And then this is actually really funny. A lot of people will say, like, my mom used to say this, like I'd always put my hair up in a tight bun when I was like studying. And she'd be like, put your hair down or your hair is going to fall out. And I was like, is that for real? Like if you have a tight ponytail or a tight bun. But it's true. It does. So it's like, okay, maybe don't sleep with your hair tied up so tight. So
Good point.
But then when we talk about alopecia, that's different. And that's when you might need to see a dermatologist. You might need to have steroid injections. You might need to take medications to help with the hair growth to come back.
Yeah, I'm glad you weaved that in there, because I think you can learn a lot from just talking to a patient about their hair loss, about the pattern and the timing, and you might be able to solve the mystery just from taking a good history.
Right.
But I think if you can't get to the bottom of it by just asking the questions, a dermatologist and a biopsy is going to be an important next step.
Yep, absolutely. And I think a lot of people try to wait it out, but
of course,
if it's happening, it's not a bad idea to get a consult.
So how does hair loss typically come up in a visit? Is this typically someone coming to you with a scheduled appointment that wants to talk about hair loss, or is this typically an oh, by the way sort of thing that comes up in the appointment?
I think it's mixed. It depends. So I feel like the older females that are coming in postmenopausal, they tend to say, okay, I'm going through menopause. I've got hot flashes. My hair is falling out. This is all that's happening. They start listing all their symptoms. I feel like the younger women kind of dance around it a little bit. They might, come in for something else, and then it's, oh, by the way, I've been really stressed, and I've noticed like clumps of hair coming out in the shower. My boyfriend's complaining about it, or, someone else has noticed it. And that comes up in that way. So
if it's enough to create anxiety in you, it's certainly enough to bring up to your physician.
yeah, absolutely. And like I said, it's like there's no like taboo topic for a doctor. Like we've seen a lot of crazy things over time. And so like nothing's really surprising. Like I've had a couple of patients that have come to me saying like, oh, you've probably never seen this before. And it's like chances are if you're a doctor trained at a level 1 trauma center, they've seen it.
Right.
So
Right. Yeah.
Nothing to be too embarrassed about. Okay, so our last topic that we have today is itchy things below the belt.
Itchy, rashy, bumpy things below the belt.
Yes, the things that people, it's just an area that people are uncomfortable coming in to talk to their doctor about, I think.
First, let's talk about STDs, right? So STDs, or I guess nowadays we're calling them STIs.
Sexually transmitted infections as opposed to a disease.
Yep. So this probably should be its own podcast. I think this is a mountain of a topic, but we can talk about a few things right away and we can categorize things. So the way that I teach residents and medical students and talk to patients about STIs is put them in 2 camps. You've got lesions, things that cause lumps and bumps and sores, and you've got things that typically cause discharges. So the things that cause lesions, lumps, bumps, and sores are things like syphilis, herpes, HPV, which causes genital warts. Certain types of chlamydia can cause lesions. And then you have the things that cause discharges, and that would be your chlamydia, your gonorrhea, trichomonas, and then BV and yeast infections.
Yeah, can we talk about, let's talk about the BV and yeast infections a little bit, because that's really common.
We got to talk about BV and yeast infections. So I think that this is one of the things that I see young adult female patients quite frequently in my practice.
Yeah, I do as well.
Yep, recurrent BV and recurrent yeast infections.
BV stands for bacterial vaginosis.
Yeah, so what this is it's a type of bacteria that changes the flora of the vagina and causes a discharge that's uncomfortable and frankly smelly. And what it fundamentally just comes from an alteration in what the normal flora should be. The normal flora should be leaning more towards lactobacillus, which is a fairly benign bacteria that doesn't cause a lot of problems.
So it's more like clear discharge, not too heavy.
Yep.
There should not usually be like a fishy odor to it.
And when that flora starts to transition more towards the BV, then you get the yellowish discharge. It can be foul smelling. It can sometimes smell fishy.
And it can wet your underwear as well. A lot of women come in saying like it's like heavy discharge.
Yep. And it can be uncomfortable. So that's typically the launch point for someone who comes in with BV. I think it's important to mention that BV and vaginal yeast infections are not in and of themselves, I don't consider them to be sexually transmitted infections, not in the way that gonorrhea or chlamydia is.
Right, they don't spread from one to another.
Right, but there can be an association in sexual activity. So you might find women who say, I always get a yeast infection after sex, or I always find that my BV tends to flare up after sexual intercourse. Could it be my partner? Not necessarily. It could just be that the act of being sexually active is altering your flora in such a way, and it's predisposing you to
and
getting
sometimes the
BV.
condoms as well can cause issues with yeast
Excellent point.
infections. So
Excellent point.
That's something to think about. And then taking antibiotics can cause yeast infections.
That's the classic one, right? So I think there's a lot of women out there who could relate to this. You know, you take an antibiotic for a urinary tract infection or a sinus infection, and then, you know, a week later you get a yeast infection and you have to take a dose of diflucan to get rid of that. So that's a very, very common thing that people should not be ashamed to talk to their doctors about at all.
Yeah. Now, when you mentioned bumps and, you know, that kind of thing, and I think there are some common bumps that happen that are not like sexually transmitted infections that people are so concerned about. Like I see that a lot in my office if they'll say, oh my gosh, I've had the same partner for the past 5 years, but now I've got this bump down there and it ends up being like a razor bump or something really benign. What are some of the things that you've seen that are pretty common that are relatively benign?
So you hit the big one there. I think razor bumps or, you know, little irritated hair follicles. People commonly will mistake those for genital herpes or something else, and it can cause just a massive, massive amount of anxiety.
Yeah.
There are other rashes in the groin area that are not sexually transmitted infections. Typically, men get jock itch, which is a type of skin fungus. It's very benign. It's very treatable with a topical antifungal. Women can get growth cysts, basically, called Bartholin cysts. There's one on either side of the labia that they can, get blocked up and swell, and they can be painful, and they can look like STDs if you're not aware of what they are. So that's another thing I see quite a bit.
Yeah, I think yeast infections are a big deal, skin yeast infections, because just like babies get diaper rash, like in between like your thighs, or sometimes for women in between their breasts, they can get rashes, and not realizing that it's just a yeast infection, and you can take a topical cream that can clear that up. I think I sent you a patient actually who was very concerned about a lesion in his private area. And to be honest, it looked different than normal. And I kept looking at it. I'm like, I don't know. And then his girlfriend was like yelling at him in the room, like, if you cheated on me, it's over. And I was like, oh my goodness. And so I think I had given him a cream, and it wasn't working. So I was like, you know what, I'm going to send him over to Nick.
Sure.
Nick will take a look at it and see what can be done. And it ended up, ended up just being a yeast infection or something.
So, there's typically a stepwise approach to these. Like, so BV and vaginal yeast infections can be unbelievably frustrating. They can have a recurrent, relapsing sort of nature to them.
And it's very common.
And it's extremely frustrating. So don't be ashamed to talk to your doctor about this. You don't have to hide in the shadows. I think that this is a very common thing, and it's a very treatable thing. Same thing with STDs. I mean, for crying out loud, just talk to your doctor. I know you're embarrassed, but this is what we do.
Right.
And honestly, STDs, if untreated, can be pretty serious.
Right.
For women, they can lead to infertility problems. Same thing for men. And then, of course, we always got to think about HIV, right? If you have one STD, if you have gonorrhea or chlamydia,
you could have others.
Exactly. There could be other STDs lurking in the darkness, too. So we got to look for all that stuff.
Yeah, and I think it's just having the open communication, being able to say, this is what's going on, and know that there's like no judgment on the other side.
No.
Like I said, we've seen a lot of things, experienced a lot of things, and so it's like the chances that you shock your doctor is pretty low.
Yeah, and let's not forget, your confidentiality is protected, right? Your patient-doctor communications are confidential. We're not out there, posting on social media. You're not going to believe this patient I saw today. It just doesn't work that way. I think that we approach these with seriousness, and we want to make sure that people are getting the right care.
Right, and also with teenagers too, a lot of people are afraid to come in thinking that, maybe my parent's going to find out in some way, and it's like what you talk to with your doctor is absolutely confidential, so you don't have to worry about, getting a report to your parents about like having an STI.
Excellent point. Well, I think that's about all the information we have time for today. Asha, thanks for going through those questions.
Yeah, thanks, Nick. I think hopefully we've helped a lot of people realize that they're not alone out there in some of these embarrassing symptoms. It's really common, and that's what we're here for as healthcare providers. There's no topic that's taboo. And as your doctor, if we know what's going on, we can help you and advocate for you.
I totally agree. That would be my big takeaway here, is that you shouldn't be ashamed to ask these questions. These are questions that we face on a regular basis. And if there are certain questions that are just burning and you want to bring those questions to us, then you can send your questions to podcast@beaumont.org, and Asha and I will be happy to take a look and get back to you on that.
Absolutely. Okay. Well, thanks for joining us on the Beaumont House Call.
If you like what you heard, please feel free to leave us a review. We're always looking forward to your feedback.
Continue your journey to living a smarter, healthier life. Visit beaumont.org/podcast to access information and resources related to today's podcast.